Hello, everyone. Welcome, welcome. We are so happy to be having this important discussion today, and we are happy to have you all joining us. As you know, we're going to be talking about pumping and breastfeeding rights during COVID-19, navigating new workplace challenges, and that has been put together through the Department of Health and Mental Hygiene under the New York City Commission of Human Rights. I'm your MC for today, Veronica Guiti. I'm the founder of Moms Make It Work. And just a little about Moms Make It Work. We're an organization that has formed a community for moms to come together and just encourage one another to go after their dreams. However, we know that how hard that can be if everything is not put together. So we offer workshops on moms focusing on her identity, her finances, her peace of mind, and self-care. So we go through so much, but together we will be able to keep it working as we always do. And so the main thing is to let you know that you are not alone. As moms on this journey, we go through so many joys and challenges. But one of the challenges should not be on whether or not we're going to breastfeed or leave work because of it. And so that's what we're going to be talking about today. What are your rights when you go to work? What should you be hearing from your employer, from your boss, to make sure that you are in a comfortable space to do what you have to do and not feel worried about losing your job? I'm very passionate about this subject, and I was so happy to be asked to be a part of the conversation. It's going to be a great hour, so I hope if you haven't done so already that you call up those in your mommy tribe, let them know that they should tune in. They still have some time, and just to get all the information that's going to be offered here today. So I don't want to take up too much of your time because we have so much in store for you in this great hour. I want to thank again the Department of Health Commission on Human Rights for asking me to be today's MC. And I'm just going to go ahead and pass it on to Dana Sussman. She is the moderator for today's event. She's the Deputy Commissioner of Intergovernmental Affairs and Policy. And she will go ahead and take it from here. Thank you so much, Dana.
Thank you, Veronica. Thank you, everyone, for joining us today. We are also, I believe, hopefully streaming on Facebook Live right now. As Veronica mentioned, I'm Dana Sussman, Deputy Commissioner for Intergovernmental Affairs and Policy at the New York City Commission on Human Rights. The Commission is the city agency that enforces the New York City Human Rights Law, which is one of the strongest laws that protects your rights in the workplace, in housing, and in public accommodations. And we have been working for the past 5+ years on making clear what folks' rights are with respect to pregnancy and lactation in the workplace. In 2016, I believe it was, we published our first guidance materials on pregnancy accommodations, which means that you have the right to request and to receive accommodations to maintain a healthy pregnancy and to work. Your employer should be engaging in a back and forth in what we call a cooperative dialogue to ensure that you are able to have those accommodations that you need to maintain a healthy pregnancy and to continue at your job. And then last year, we implemented new explicit protections around lactation in the workplace. This means that employees are entitled to reasonable time to pump, a lactation room with certain requirements, and a lactation policy that they receive. Now, we know that workplaces are diverse, workers and their roles are diverse, and so not every workplace is going to have a lactation room with all of the requirements that the law assumes. And so in recognition of that, we've put together a lot of resources and materials that acknowledge all the different workplaces and all the different limitations that both workers and employers might face as they juggle providing accommodations to a worker. The most important thing to take away, though, is that employers have an affirmative obligation to work with workers to figure out what they need in order to pump, and that could be 3 times during their shift. That could be 2 times during their shift. That could be a period of time that's 45 minutes or a period of time that's 15 minutes. And we really try to break all of that information down for employers who may have no familiarity whatsoever with what it means to pump at work. we just put some of the resources around these materials in the chat in a link, so you can check those out. But I also just wanted to flag that I am a mother of two. When I was pregnant with my first child, I was helping to draft our pregnancy accommodation guidance. And when I was pumping with my second child, I was writing the lactation guidance. So it's a personal passion of mine and of many of the people I think who you'll hear from today, but also it reflects like the lived experience of what it means to pump at work. When we were thinking about this, we were having conversations with different employers, and employers don't know, some employers, predominantly men, or don't know what a pump is, or why you would need to be connected to an outlet, or why you need access to running water to wash pump parts. So we broke all that down in a document that was geared towards employers. I used to joke that we called it "What It Means to Pump at Work," because there's this default, I think, in the world around men as workers, and I think that still exists today. And I think there's an inherent discomfort in recognizing women's bodies, women's experiences, particularly around pregnancy and around lactation. And we tried to, with those materials, really demystify a lot of that stuff and make it about, okay, what does it mean? How much time? That can vary. That can shift over the course of your postnatal period, and all of those things in sort of real world, real life tools and information. If folks are not getting the accommodation that they need, they can call us, and you can reach us through our website, which is nyc.gov/human-rights, or through 311, and we can help you advocate for yourself to get the accommodation that you need as quickly as possible. We can also, call the employer and talk to them. We can file a case if that's what's required to ensure that your rights are protected. So with that as just background information, I would love to just introduce our incredible panel. We'll be putting their bios in the chat, but I'll just do a round of names and titles, and then everyone will get an opportunity to introduce themselves and the work that they do as it relates to supporting breastfeeding rights and lactation rights in the workplace and beyond. So we have Ria Smith, Director, Women's Health and Government Affairs from the Caribbean Women's Health Association. Jessica Lee, Staff Attorney for the Center for Work-Life Law. Leticia Rios, who is a lactation consultant and a nurse educator, and the owner of Perfect Latch LLC. And we have Vicky Grimshaw, who's Policy Director at the Division of Family and Child Health for the NYC Department of Health, and an incredible partner on much of our work. So I'd like to just kick it off to, I suppose let's go in that order, if folks can remember it. We'll start with Ria Smith. If you could just introduce yourself and share a couple, for a couple minutes, how your work relates to the topic and some of the challenges that we're facing, which I didn't even acknowledge today, around changes to the workplace, changes to parents' lives in light of COVID-19. So Rita, if you're able to jump in and unmute yourself. Yes, there we go.
Thank you. So much has changed. Since 1982, Caribbean Women's Health has provided support to fill the gap in disparity areas. Services range from HIV testing, prevention, awareness, maternal health, particularly breastfeeding, safe sleep parenting, and doula support for expecting and postpartum. They receive the information through curriculum-based programming, and workshops, and support groups, because they know that COVID-19 has exacerbated many racial inequities that have long persisted in reproductive and maternal care. Most recently, due to COVID, we have had to, how should I put it? We have had to take our live sessions and turn them into virtual online sessions, which, we've had some issues with that, getting it up online, having women, especially for breastfeeding, participate in such a way where you don't have one-on-one. but it's part of the work that we do in continuing to provide the support needed to end severe maternal and infant mortality in our community. Right now, East Flatbush, which is where we are based, has the highest rates in the city for Black maternal health outcomes, and it's just startling. We just lost a mom a couple months ago. Hoping to continue this work to be able to provide this extensive relief for families and for as it relates to families, lack of support that is there for a lot of our moms relate to the fact that they can't tell each other, and especially if one is going to work and back and into the household with a new baby, and concerns and high anxieties relate to breastfeeding and having to do so with COVID or not knowing you have it. So lots of real issues.
Thank you. Thank you so much. I know it's been an incredibly challenging time on so many different levels, and not being able to be together, I think, just adds a whole nother layer to it in the same physical space. Let's turn over to Jessica Lee from Center for Work-Life Law, who's a staff attorney there, and who, just on a personal note, worked on or provided expert help on some of the materials that we put out for the city. So Jessica, please introduce yourself.
Hi, my pleasure. And I also just recently stopped breastfeeding. So I think a lot of us here share both a personal and a professional relation to this work. And shout out to those of you out there who are currently breastfeeding, lactating, pumping at work. I know it's not always easy, but I'm glad we have such a committed group of folks here who want to support you. So I'm the staff attorney at the Center for Work-Life Law, where I work with healthcare providers, community groups, and institutions to help them better support the needs of lactating people at work. I also co-lead our helplines for pregnant, caregiving, and lactating workers and students. So we work directly with folks who are trying to implement policies to make better solutions, make better laws for folks, but we also work directly with people who are going into work day in and day out and navigating these accommodations. And as you can imagine, we've put in a lot of work over the last few months helping workers who face challenges getting lactation space, time, or other needs related to breastfeeding met as a result of the pandemic. This has always been challenging, as a lot of the longtime advocates on this call will tell you, that ignorance of the needs of breastfeeding workers is really widespread. But with the pandemic, folks feel more vulnerable as a result of the economic crisis. And at the same time, there is a greater need for us to all be able to meet our breastfeeding goals to keep our babies safe. So it's my honor to be able to help workers get what they need. And today I'm happy to share a little bit about what we've learned.
Great, thank you so much. And let's turn to Leticia Rios, who is a lactation consultant and nurse educator. If you could just introduce yourself and your work as it relates to some of the challenges that we're facing during COVID-19.
Thank you, Dana. And I too am so happy to be requested to be a part of this panel with all of you women who are doing such great work to support mothers who breastfeed. So I am the owner of Perfect Latch LLC. I have contracts with the New York City Department of Health and Mental Hygiene to facilitate baby cafes in marginalized communities such as Brownsville to help decrease the Black maternal infant mortality by increasing the initiation and duration of breastfeeding. Also, the moms that I serve through the baby cafe are affected by a lot of social determinants of health. So we make sure to address those issues such as food insecurity, access to transportation services. So we provide Metro cards and more meals each cafe session, as well as to provide skills training for breastfeeding skills and also knowledge training so that moms can advocate for themselves during pregnancy before they have the baby in the hospital setting, knowing what to expect and what their rights are as it pertains to breastfeeding in the hospital setting. And also we continue the support after they have been discharged and have went home. As we know that when you go home, initially you still have are in transitioning into that fourth trimester where it's really difficult and support is really crucial to the longevity of breastfeeding. So we provide support for that as well. I also have contracts with the Creating Breastfeeding Friendly Communities grants where I provide education and skills training for pediatric and OBGYN offices so that they can become more breastfeeding friendly in order to support moms who desire to exclusively breastfeed when they come back for visits, and then they get trainings and conversations begin during their first trimester about optimal feeding choices. And also, I am contracted with the maternal and infant reproductive health, where I provide lactation consultation services to mothers who live in shelters so that they can get the support that they need to continue to breastfeed and also to start breastfeeding if they need that help.
Thank you so much, Leticia. And I'll turn it over to our last panelist, Vicky Grimshaw, who is a partner in government over at the Department of Health. Vicky.
Great, thank you, Dana, and I'm so pleased to be here. So I think like a lot of folks on this panel, I'm not just a bureaucrat, I'm also a person and I'm also a parent. I have two children, ages 4 and 6, and so I think while Dana was writing some of her lactation guidelines while she was pregnant, I was actually busy writing a paid family leave grant while I was pregnant. So I think a lot of our work tends to overlap. So I know just how hard breastfeeding can be. I did it with both of my children, and there's biological challenges as well as obstacles that you encounter living in a society that has come a long way, but still has a really long way to go to support breastfeeding overall. So when I was pregnant with my first child, that was back in 2013, we've made the terrible decision, which I wouldn't recommend to anyone, to move right before I delivered. So we didn't have any friends or family around. We'd moved to get closer to my parents who were going to be providing childcare for us. But they were still about a half an hour away. And I don't know if anyone remembers the winter of 2013, but it snowed a couple inches probably every day. And I was struggling. It was my first, and I was really struggling with breastfeeding. It was very hard. And so even though I was home and I was not back at work, our agency actually contracts with a lactation consultant. And so I was able to get lactation services via phone during that pregnancy if I needed them, and I did. So that was a really great resource. But we know that not every employer is going to offer that. So I will say that that's the one potential upside of this COVID-19 pandemic. If there is one single sliver of a silver lining in this, it's that it's actually really greatly increased access to teletherapy and access to lactation services via teletherapy. And that's wonderful for those who may need that. So that's something that we're going to hope to support. We hope that it will continue after the pandemic, and we will certainly be supporting policies that extend it after the pandemic. And in addition to that, we know that we need to expand the number of providers that are able to offer lactation services. So there was actually a bill recently that was signed into law that does expand the number of providers who are able to offer lactation services, and that's something that we supported as well. So on the professional side, rather than the personal side, we are constantly monitoring legislation that will increase access to lactation services, as well as partnering with groups like the City Commission on Human Rights and other agencies to really expand workplace rights to enable workers the ability to express breast milk in the workplace. And then, although COVID-19 is going to increase access to lactation counseling, we know that it's going to also present a number of other challenges for workers who are trying to both work and lactate through this pandemic. And so one of the things that our offices used to be able to offer were community lactation sites. And we really tried to support, as the Department of Health, access to places that people could go in the community by partnering with businesses, by opening our own offices as spaces for community lactation. So maybe you worked for an employer that doesn't have a space that you're able to express breast milk, but you are close enough to one of those sites where you can go and express milk. But with the COVID-19 pandemic, closing down a number of businesses, as well as restricting access into the buildings that maybe had a community lactation space, we know that that's going to be really, really challenging for folks. So one of the other things that we've supported in the past is paid family leave. And actually, we were successful in getting the grant that we had written for paid family leave. And one of the things that we found in looking at leaves was that if people were able to take a longer leave, and we know that people are able to take longer leaves when they are financially able to do so, and paid family leave helps with that, they did end up breastfeeding for longer. So that's great too. And so for today's worker who may be struggling with even finding a place to lactate, paid family leave can be a really great policy that can help them stay home if that's what they choose to do, so that they can breastfeed their baby instead of needing to pump. But that said, there's a number of limitations to paid family leave. This year, it's only a maximum of 10 weeks. In 2021, it will be up to 12 weeks, but it also doesn't replace a worker's full pay. It's only about 2/3 of wages. And for people who are trying to make rent, we know that 2/3 of your paycheck is not enough when you're struggling to get by even on your full salary. So we need to really increase the wage replacement rate for workers, especially low-income workers, and we need to make that longer. The AAP recommends exclusive breastfeeding for the first 6 months of life. 10 weeks, 12 weeks, that's just not enough. So there's still a lot of work to be done, and the health department is certainly going to be supporting policies that help support workers breastfeed. Thank you.
Thanks, Vicki. So if there's any employers on the line, which there may be, one could consider lactation consultants for your employees, which I hadn't actually heard of, but not totally shocked that Department of Health would be on top of that one. So I'll turn over to Jessica. You mentioned that at the Center for Work-Life Law, you oversee a hotline for workers to call in on a whole host of issues related to caregiving, pregnancy, and lactation. And I'm curious if what you've seen sort of nationally or, in different parts of the country around the challenges, issues around lactation, whether it's for essential workers that are out or workers that just don't have the luxury or the privilege to work remotely. And then also for those who do work remotely, if that's been posing a particular challenge in balancing, as many of us are, watching our children, working at the same time or working with other people in the house. So if you could just speak to that, Jessica.
Yeah, this has been a massive upheaval. Breastfeeding workers are dealing with the childcare crisis, I think, first and foremost. And we get a ton of calls from folks who are looking to take leave or to adjust their schedules. Thankfully, there's that paid family leave, and there are also a couple of options for folks who need to stay home because they don't have childcare. We've also helped many folks who have health conditions like postpartum conditions with disability leave. But at some point, when folks go back to work, they do need that lactation space and break time. And the pandemic is creating some extra challenges for folks on that front. Some people are finding it harder just to get that time. For example, in places where the staff has been cut back due to budget issues or lower numbers of customers, it's suddenly harder to get the time off that you need to pump because someone needs to cover you, and now there's less staff who can do that. And it may even take longer to pump than usual. Disinfecting takes time. Stress increases the amount of time it might take for you to fully express the breast milk. There's lots of factors that play there with the time issue. Other workers are dealing with the space issue. It's already challenging for many folks who aren't working in offices, even in the best of times. And now there's no evidence of transmission of COVID in human milk, but anytime we're dealing with the shared space, we're worried about infection. So shared spaces that used to work might not work anymore because maybe only one person can be in there at a time. And sometimes folks don't want to have buffer periods between use. We've worked with employers to help them figure out how to stagger shifts so that all the breastfeeding workers aren't competing for that same space at the same time. Other folks have been able to get changes to reduce that amount of buffer time needed, like increasing ventilation using HEPA filters or putting up room dividers. But people might need to get creative. Thankfully, the law requires that collaborative process that you mentioned to figure out breastfeeding accommodations at work. So the boss can't just say no and be done with it. You have to have that conversation. And then finally, break time and space are really the big ones, but there have been lots of other surprises that we didn't really suspect. For example, we've been talking with workers at businesses that no longer allow folks to use the shared refrigerator, or they're prohibiting employees from bringing in outside bags or bringing in food, so moms can't bring in their coolers, or they're told they can't bring in their coolers. Obviously, that's a big problem because the right to express breast milk at work should include the right to keep that milk safe, right? As you said earlier, Dana, a lot of folks just don't understand what we need as breastfeeding workers. It wasn't even registering for people that that refrigerator is an important lifeline to keep someone being able to provide milk for their baby. And as you mentioned, though, some workers are really fortunate and are in a great situation for breastfeeding because now they're able to work from home, they can be with their babies. But another surprise for me is that there have been a small number of moms that are even challenged about breastfeeding while at home. For example, I had worked with one student who was told she couldn't turn off her camera while breastfeeding during class, but she also couldn't breastfeed on camera either. So she's caught in an impossible position. Worked with another worker who was told she needed to track the time that she spent breastfeeding so that she could make it up, even though nobody else was forced to track their time taking breaks for other reasons like eating or using the bathroom throughout the workday. So putting workers under that magnifying glass, that's a form of sex discrimination. We often don't hear it talked about. But, it's not all bad news. There is a lot of support out there. There are a lot of employers who know that breastfeeding is going to keep workers and their families healthy. But the general feeling that I am hearing from folks who call us is that they sort of have a target on their back because of their childcare needs or because they're breastfeeding. And they're nervous to talk about what they need. And that hits at a part of the legal protections that I don't think we often talk about enough, which is you aren't just entitled to the break time and space, but it's your right to get the accommodations you need and feel safe in your job. That retaliation is illegal. And there are lovely people to call if you need help with it. The specific advice I give usually varies based on the situation, but in general, my advice for folks who feel nervous about requesting the break time and space is usually just be strategic but not fearful. Don't want you losing sleep every night about this, but we do want you to be really mindful about how you approach it. And the first step is doing what you all are doing now, knowing your rights, knowing your options. I encourage folks to ask in advance for what they need. Many workers don't really bring it up until they're back to work, which can create a crisis. And most of the really bad cases I've seen, that's the sort of situation. But if you ask early, it takes the pressure off and it gives you time to be creative and have that conversation. Next, I always remind folks to take notes, save emails of anything that is said. If you're denied accommodation, you have a right to ask for that written result of your conversation, like in writing, so that you have it. And if you need to file a complaint, you can. Be on the lookout for warning signs that something is wrong. That's suddenly lower evaluations, schedule changes your boss knows doesn't work for you, maybe an attempt to get you to stop showing up. Anything that you feel in your gut just isn't right, look out for it and ask for help if you need it. Find the commission. If you see those warning signs, don't delay, because most employers really do just need that simple education or the creative ideas on how they can meet the legal requirements. And the sooner you reach out, the faster you can help. So that's why I'm so happy that these folks are here. And I hope community groups, healthcare providers, and lawyers like us can keep stepping up to let working families know we have your back and the law backs you up too. it still really applies, even though it feels like these are such unprecedented times. The law is still here, and we're here to help you get the support you deserve.
Thank you so much, Jessica. I could hear you talk about this all day, I think.
Me too.
I know. It reminds me, though, some of your comments, specifically around like the timing issue. This is such, both pregnancy and lactation, these are such time-sensitive needs. This is about keeping someone in their job in a healthy way with the support they need, and these are, and it, especially for lactation, I mean, waiting a few days to figure out what the accommodation is going to be could spell, I mean, as many of us know, like could spell the end of your breastfeeding experience sooner than you may have anticipated. And so when the law was negotiated in New York City, it says that employers must respond within no later than 5 business days. And my colleagues know this, but I was on parental leave when that bill was being negotiated. But had I been at that hearing, I would have been crawling over the table, being held back by my colleagues saying 5 business days, that cannot, like, you don't understand. 5 hours is what we're realistically talking about here. And of course, I think it was, a certain councilman who thought that 5 business days was too onerous on the business. And again, I wasn't there. I wish I had been, but that's the premise of what we're working with: 5 business days to respond to a request. And so our advice too is to employers is, when someone goes out on parental leave, send them the policy, send them the accommodation request form, and get that process started early. And also to the worker, get the process started early. Talk to your physician, pediatrician, whoever you need to, so that you kind of have what you need in place by the time you return, so that hopefully you're not in that crisis situation that can be so incredibly stressful. Yeah. But I'm going to turn over to Ria from Caribbean Women's Health Association. You touched on this in your opening remarks, but I wanted you to speak to your work connecting the ability to breastfeed and to breastfeed safely and supportively, when folks return to work, to some of the work you're doing to address racial inequities in maternal health and in reproductive health. So how has that shifted? You spoke a little bit about this, but how has that shifted during COVID-19, and what innovations or what changes have you made to kind of address those new challenges?
Well, first thing for us is empowering our women. And by empowering our women, that means bringing that education, that knowledge, and that, level of confidence back to them. We have had several support groups and several workshops where moms are having high anxiety, about not just going back to work, just mom, for the first time in the middle of the week. What's going to happen to the baby? What's going to happen to them if they get sick? What's going to happen to the baby if they get sick? What's going to happen to the other families that get around them? Virtual really, to be honest with you, our virtual offerings almost tripled in size for participation. People did not have to worry about the stress of getting on a train or to get to train our bus to get to the office. And they had I wouldn't say luxury, but, the luxury of being at home and being relaxed. Benefits for that couple hours. That's probably the only time a lot of our moms got a chance to relax. There were some that had kids with them and their partners with them. And what we did was continue that support group, and we opened it up to create a WhatsApp chat room with them. And so we were having conversations 1, 2 o'clock in the morning. I felt like I was an on-call aunt. And we really, really got to know them and know their plight. 2 of them are living in a shelter, and there are issues there with cleanliness and noise, and brand new baby, kept up at night because of it. And so for us, we look to make sure they understand their rights, know what they are, and we have so funny. I kept this near my desk, this little booklet. Everyone gets one. Everyone gets one. We also let them know that if they need a support letter from us for their employer, we certainly can provide one. But, you know, largely, too, we work very closely with elected officials that are also willing to provide that level of support, especially those that have platforms that relate to Black maternal and breastfeeding, like Brooklyn Borough President Adam, Assembly Bishop, Carol Rodney Bishop just got passed through state assembly for Jonah Cow bill relates to Black maternal health. She herself has a child, bringing the child, so to speak, and we have some really strong champion advocates at funding small nonprofits and these types of programs. And we believe also by empowering the women, you also have to have a level of blanketing in for the small businesses and the businesses that hire them. A lot of them are immigrants. They work in small businesses and stores just around our neighborhood. And you'll be surprised how many people don't even know this is a law. And this exists. And, you know, 206C and the Civil Rights Law and on all of those that bunch up together are things that women depend on. And also advocacy for things like, you know, having that time to breastfeed and express up to 3 years old possible. Because there are women and children that continue to have that bonded relationship up until that time. You know, some of the other items relate to ensuring that proper signage, things are up in those workplaces in different languages, because on our side in Flatbush we have not just Spanish speaking, we have Creole, French Creole speaking as well, and that is a large population that has been underserved for a number of areas, but they, especially the language barrier, keeps them out of services and free services that they could really take advantage of, and increasing some of that opportunity to stay at home for both partners as well, because if mom is working partly, someone needs to be who can afford daycare, and you can take. So those are some of the things that we've been doing, and the outreach has expanded to in some of our local provider sites, private spaces, right, the county, some of the private offices, you know, clinics, visit, go there to educate, sitting with the doctors, so providers, sitting with moms to let them exist, and services exist, and our partner services exist. So yeah, we had to, you know, virtual has come, and it's actually more work, but it's just the work that we continue to add it. So.
Wow, it's incredible work that you're doing, and I love the WhatsApp chat that, you know, everyone needs to have someone they can, as new parents, to chat at 1 a.m. It's incredible to have that. Yeah.
What they do. Our moms are young friends. One of them recommended Snapchat, and we're like, what? So we just learned the WhatsApp, and now we're on to Snapchat, and now we're on to something. So yeah, it's also a learning curve for technology. Totally.
That's great. And I love too the point. I mean, there's so much we could talk about, but just thinking about involving, you know, dads or partners of breastfeeding parents in all of this, and having them sort of get time with their babies and to support the breastfeeding parents. It's a critical part of this that I think is often overlooked. Yeah.
Especially in our Black community, we are planning for fall winter to have a fatherhood program start up, where we have dads teaching dads about a number of things, including what not about breastfeeding, but what breastfeeding, the importance of breastfeeding, what it actually does to a we get pretty open and candid in communications and discussions because that's the reality in the world.
That's great. Thank you. I'm going to turn to Leticia. Now, you're sort of our resident lactation consultant and nurse educator on the panel. So as you're providing services to your clients, what does that look like now, and what are some of those challenges that you're seeing? And do you have a sense that that your clients know what their workplace rights are, and how do they navigate returning to work, and how can we as government or as advocates here better support those new parents as they journey back to work and hopefully continue to breastfeed or pump?
Can you hear me?
Yes. Yes.
Okay. So we were doing a lot of in-person sessions with our baby cafe, and I see you moving, but I can't hear anything.
I can hear you.
Okay, no problem. So we were doing a lot of in-person sessions with the baby cafe, and with the whole COVID pandemic, we had to quickly transition to virtual meetings because we wanted to keep the connection that we had with our moms. They become like a family, and they become a very strong peer support group to each other. So we wanted to keep that momentum going. So the issues that we have seen probably are the disparities that affect the moms in the communities that we serve, as far as like having electronics that they could be able to connect with us virtually. Maybe they may not have a computer, maybe they may not have a phone, maybe they may not have the data services to support them logging on. So those are some of the challenges that we've been faced with, as far as disparities of the women in the communities that we serve. They may not have access to devices to be able to log on virtually. Most of our moms have, so we have continued to support them virtually every week. They log on. Most of our moms were pregnant when we had to switch to virtual. We even connected with them while they were in labor in the hospital. They called into Baby Cafe. They're like, I'm in labor, I'm in the hospital, I'm talking to us, because that support is very, very crucial to their mental health, and to them feeling comfortable and feeling like they have the support that they need to go through the challenges of pregnancy and breastfeeding. The challenges that I have with supporting moms one-on-one are that I used to rely on skills using my hands while I was working with these moms, and now I'm not able to touch them or help them or tuck hair, or I'm not able to really do a good oral assessment. So I've been having moms use, if they are able, use two devices, a cell phone and a laptop or computer, so that they can use the cell phone, which is more mobile, to do like visual oral assessments, while also using a computer so they can see my body language or see positioning or different things like that. So having to be creative with new ways to assess parents and adapting to the change of supporting moms during COVID. So those are the challenges that, are faced, as far as, not being there in person to just give them that support, that touch, that hug, just having to connect virtually, and trying to find the ways to use devices to be able to optimally provide an assessment and communicate with their providers to have a plan so that we could help them to stay successful with breastfeeding. We have always been a program that have strongly supported moms and provided support for them to be able to get the support they need in their work environment. So with the CBFC, creating breastfeeding-friendly communities, we have a coordinator, Priscilla De Jesus. She reaches out to their providers if they are not knowledgeable about the rights of mothers who are breastfeeding, and she provides them with education, the law. She provides them with options and different ways that they can provide the support that the moms need. So we take a really hands-on approach to connecting with the provider, the employers of the moms that come to our baby cafe, in giving them all the information and resources that they need, so that the moms that come to us saying, well, you know, I work in an office and it's all see-through. We'll say, okay, maybe you can get a partition. You know, we give them ideas and they bring it back to their provider, and that dialogue is happening. And we you know, we're the middle person that's connecting the law and the resources to the providers and to our moms in our group. And we have know your rights training that we provide to the moms, like maybe once or twice a year, so that the moms are aware of their rights and they can advocate for themselves. And we do encourage them to start that conversation very early during pregnancy, so that they could know like what to expect, and their employers can know what to expect and what it's going to look like when they return to work after, because we want them to remain successful. We don't want the breastfeeding to take a drastic change for the worse when they decide to go back to work. We want to make sure that they're prepared.
That's terrific. It's music to my ears that you're getting creative with all of these things. It's and you know, providing some of that support to the moms as they return to work. I did want to. I know we're about 10 minutes away from closing, and I have one question that I wanted to pose to anyone who wants to answer it, which came in, I think, from Facebook. So, have there been considerations for mothers of multiples who are breastfeeding and pumping? This is from a mom of twins who's a teacher, and she's currently pumping or nursing 7 times a day. So if anyone wants to just jump in with some thoughts on that, and I'm happy also to share a little bit of my perspective after that. And just a reminder to unmute if you want to jump in with a comment.
This is Jessica. I think you can hear me. 7 times a day is really rough. I think that's one of the reasons why there is flexibility sometimes for reasonable accommodations beyond just the break time and space. It could be that a good accommodation for somebody who's having to take that many breaks is working from home. And that's something that I think folks, hopefully we can equip folks to feel comfortable having that conversation with their employers about just how they can continue to be effective at work while meeting their lactation needs. Sometimes that looks like breaks in a lactation space at your job. Other times that means doing your job from a place where it's easier for you to get that pumping or direct breastfeeding, which typically takes less time. But I'd love to hear what other folks have to say about getting those accommodations. One thing I will just add is that that's been one of the changes that I've been really happy to see with the pandemic, is that more people are working from home. A lot more businesses have figured out how to make it work. They've tried all the technology. They've figured out schedules that enable folks to get their job done while they're at home, and so it's no longer as big an ask for some places now. They've proven they can do it, and they should do it for you if you're entitled to that reasonable accommodation.
I'll jump in as well. So one thing that had occurred to me is in our guidance materials, we don't acknowledge the needs of parents, new parents of multiples. And I think that might be a useful thing to add just as part of our employer education information. People need to know that these needs vary greatly, especially if you're having twins or more. But I will just echo Jessica in that, you know, the conversation is called, in New York City, it's called a cooperative dialogue. So it's intended to be a back and forth, and with the hope that there will be some place that you can meet in the middle. If, you know, in an ideal world, you ask for an accommodation and you receive that accommodation, the employer has to show that the accommodation you're requesting poses an undue hardship, or that there are other alternatives that could meet your needs that would be more workable for the employer. So, you know, you don't always get the accommodation that you requested, the exact accommodation that you requested, but the intention is that it's a process, and that you figure out what makes sense, both so that, you know, the workflow can continue, but also that your needs are being met. And so it looks different for everyone. And that's one of the most, I think, frustrating aspects of this for employers is they want hard and fast. Okay, what do I do? And everyone is different. Everyone's breastfeeding and pumping needs are different. Everyone's work day looks different. And so there isn't an easy answer. And that's why there needs to be that back and forth. And in fact, in New York City, failure to engage in that process is a violation of the law in and of itself, because that process is so critical to determining what people's needs are and what they are entitled to receive. I'll stop there and see if there's anyone else who wants to jump in on that particular point. Okay, and if not, before we wrap, I wanted to give everyone on the panel an opportunity to kind of give a minute or two closing of sort of what you want. If there's one thing to remember today to folks who are listening or watching, what would you want that takeaway to be? And you don't have to get super creative. It could just be reiterating a point you already made. But I'll start with Vicky. And Vicky, I realize that you didn't have an opportunity to sort of to follow up on some of the things you spoke about. So if you want to do that and also highlight any other policy initiatives or policy changes on the horizon that we should be aware of that would support lactating or breastfeeding parents, feel free to do that. And then we'll just have each panelist send it to another panelist once they're done.
Sure, thank you, Dana. So I think that the thing that I'll share, and I believe our contact information will be shared perhaps at the end of this, is that, you know, working as policy director, I'm not going to think of everything. I get a lot of ideas from other folks, and in fact, that's where I should be getting my ideas. So the more I know about the challenges that people are encountering breastfeeding in the workplace, the better I can do my job. And so I remember a few months ago, a person who was working with a transit system in New York City actually reached out to us because she was having difficulty going back to work and figuring out places to pump. And that really made us think about how we should be prioritizing having community lactation spaces. Now, granted, that was all pre-COVID, and so there's a whole other layer to the challenge on that. But those types of things are really helpful to figuring out what it is New Yorkers need to be able to breastfeed successfully even after returning to work. So please keep those ideas coming. We really appreciate them.
And pick your next panelist to send it to.
Sure. So the only person I can see on my screen right now is Jessica, so I'm passing it to you.
That works. I guess the takeaway is you can do it, but if you run into trouble, please don't hesitate to reach out. We have resources for healthcare providers, so your doctor or midwife can write a note for you. There are resources for community advocates to get involved and help you figure out accommodations at work. There is the commission. All you have to do is dial 311. There are so many people here willing to offer support, and now I'm happy to know all of you as well. We can support each other. I just don't want anyone to go through this thinking that they're alone. You're not. We're here, and we're happy to help. And I'm going to share the link to our helpline and our COVID-related leave resources in the box in case helpful for one of you.
Great, and send it off to the next panelist, please.
I see Leticia.
Hey, thank you. So my takeaway would be just to increase and continue to support in marginalized communities so that we can help to mitigate the effects of racism and to decrease the rates of Black maternal and infant mortality and morbidity, and that also I encourage and support the fatherhood initiative to encourage fathers to learn as much as possible about breastfeeding and supporting the mothers of their children in breastfeeding, their breastfeeding goals. So I encourage that as well. Those are my takeaways. I'll pass it on to.
I think it's Ria who's next. I think.
Ria. Okay.
Muted.
Oh, yes, Ria, you're muted. Sorry.
Keeps bouncing back to me. I don't know why. Can you hear me? Good. Never take no for an answer. Our babies, our bodies, and our women, our families are all our responsibility. And that's pretty much what I take. That's my motto.
I love that. Okay. Well, just a quick note. We'll leave up the screen for folks to grab any of the information that was put in the chat. I know we put in some resources. I know Jessica added some. We will also send a follow-up email to folks who we have their email address from RSVPing with additional resources and contact information. And I want to thank immensely this incredible all-star lineup of advocates, educators, policy folks who joined us today. It's really a privilege to be in community with you all today, and thank everyone for joining. I'm going to now kick it off to Veronica to close us out for today. And next week is Black Breastfeeding Week. There will be tons of programming with community advocates and organizations around supporting Black mothers. And so I encourage folks to look around for some of those resources and events starting next week. And off to you, Veronica. Thank you.
Dana, you did such a great job moderating, and I just love that you started off with your personal story. Thank all of you, the panelists, wonderful job. Thank you so much for sharing your work and the policies that you're putting into place. Ria and Leticia, for the community that you have created. I think it's amazing. As you all see, if you're watching, Dana, Jessica, and Victoria, they're creating policies out there for you. And as Jessica said, you are not alone in this. If you're a mom who's breastfeeding, as they said, if you're coming on here late, you have to know your rights. It's up to us to advocate for ourselves and our children first. Of course, we have a great community around us, but if you don't speak up, there's no one who's going to know to speak up for you. So make sure, as they said, to have this conversation early, to make sure that you know what you want so that you can inform your employer as to what you are going to need to make sure that you are in a safe environment, pumping and making sure that you're healthy and that your children are staying healthy. And one thing that was brought up is about women who have multiple children. I did not even think about that, how difficult it must be. But you know what? Now that everything is changing and we're home, we know that we're making it work. We're getting the work done. So, of course, you're going to need more time. Let your employers know. I know some people are going back to work, but negotiate. They need your services. I need your service. I need you to help me as I'm helping you. So as you saw, I was getting the work done while I was home. Please maybe extend my stay. I know people are returning to work, but maybe I can stay home and continue working from here so that I'm able to continue to provide a safe environment for my children. It's important. We shouldn't be scared to speak up. So everyone, thank you so much. As they mentioned before, you're going to see some links in the chat. Make sure you take advantage of those. They're going to be emailing you. You can, if you didn't get to see this played out, you can see it on, I believe, on the New York City Department of Health Commission of Human Rights on the Facebook page. So make sure you head over there after this, share it. Share this information with everyone that you know so that they can also have their information. Knowledge is power. We know that. So don't keep it to yourself. Go ahead and share it with every mom that you know, your whole mom tribe, because this information is definitely wealth. So thank you so much for joining us. Thank you once again to you all for having me as part of this panel. I also want to thank Kadri Chowdhury for helping to put this event together, for Doreen Bermudez for handling the tech, and everyone that we may not have mentioned. Thank you all for doing such a great job of putting this together. Have a wonderful day, and remember to always let your light shine while you're doing the thing, you're making it work. Thanks, everyone.
Thank you. Bye.
Bye.
Thank you.
Bye.
Doreen, thank you so much. Thank you,
Thank
Kadri. You all
Thank
were
you,
great.
Veronica.
Thank you so much. It was an amazing event. So much great. Hi. Hi, girl.
But you see my multiples here.
Yes. How old are they?
They're 9.
Oh.